global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
And I got to say good afternoon or good evening rather, and of course welcome to Smooth Health on the Smooth Drive, brought to you by Evercare Hospital in Lekki. And today we'll be discussing hemorrhoids. All you need to know, and to guide us through the conversation, we're joined by Dr. Arinzechukwu Mosanya, I believe. I don't know how I pronounce that, if I pronounce that right, but I believe it's pronounced as Mosanya. Am I correct?
Mosanya.
Mosanya.
Great.
Mosanya. I have a lot of Igbo friends, so why do
you do?
Almost 90% of my friends are Igbo.
Oh, yeah.
Yes, So Dr. Arinzechukwu Mosanya. Kekime. I did the right thing. Okay, so let's give you a quick rundown of Dr. Mosanya. And he's a consultant general and minimal access surgeon with extensive competencies in surgical oncology, especially of the breast and colorectal. Surgical, you see some of these things, these medical terminologies are the thing that will roll off your tongue very well, but mine, anyway, but there's endoscopy as well, management of surgical infections, management of abdominal wall hernias and defects, and minimal access surgery. So Dr. Arinze also has a keen interest in research in abdominal hernias, surgical infection, and surgical outcomes as well. And is also a member of the African Regional Group of Oncology, ARGO, and International Cancer Consortium, which seek to improve the cancer investigator in 2 ongoing studies, outcomes in low and middle income countries as well. He's also involved as a co-investigator in 2 ongoing studies designed at developing colorectal and breast cancer biobanks and database in Nigeria as steps aimed towards providing quality data for system improvement. Doctor, you are welcome to the show.
Thank you for having me. Good afternoon, listeners.
Good evening to all of you who are listening as well. And if you have any questions you'd like to ask our doctor in the house, the number to send your question to is 0809 444 0981. But we will also take 3 lucky callers and texters, right? Because you're going to stand a chance to win a 10,000 Naira voucher courtesy of our sponsors, Evercare Hospital. But we're going to go straight to the questions at hand. So, Dr. Mosanya, please explain to us what hemorrhoids are exactly.
Thank you very much. So, hemorrhoids can be referred to swollen veins in the rectum. And it's funny, but it's true. We all have hemorrhoids. However, not everybody's hemorrhoid is symptomatic. So it becomes symptomatic hemorrhoid when it is swollen and causes some of the symptoms that we're going to discuss today. A hemorrhoid that is not symptomatic functions to help us distinguish between fat and feces when we need to open the backside. So they help to manage and control the normal continence of our GI tract. However, when they become symptomatic, they can present with a couple of symptoms such as pain, swelling, and of course bleeding. And fortunately, there are a lot of treatment modalities that are available around that we can help to ameliorate these kind of symptoms.
And those things can be eliminated completely?
Well, to a reasonable degree, if you adopt those preventive measures, as well as have it checked out by your doctor.
By the doctor, okay.
All right, doctor. What are the causes of hemorrhoids, and are there different types of hemorrhoids?
So, just like I said, there are actually no specific cause of hemorrhoid, but what we call factors that can lead to your hemorrhoid becoming symptomatic. And some of these are modifiable while others are non-modifiable. So the non-modifiable include age. So the older you get, due to the normal wear and tear and weakness of the tissues in the body, your hemorrhoidal tissues may begin to sag down and then start protruding out of the anus and cause some of these symptoms. So we find hemorrhoids more in middle-aged men and middle-aged women, and also the elderly as they age. Of course, pregnant women, due to the baby in the tummy that puts a lot of weight on the pelvis, can also cause these hemorrhoids to become symptomatic. And those who have chronic constipation, so if you don't use the loo often, and some studies have demonstrated that those who use the loo infrequently, like once or twice a week, instead of the regular 4 to 5 to 6 times a week, are at increased risk of developing hemorrhoids. And of course, the big elephant in the room, those who watch movies in the toilet, read newspapers, or browse. So the longer the time you spend in the toilet, the higher the risk of predisposing yourself to developing hemorrhoid, because you put a lot of weight on your pelvis. And so we try to advise people not to spend if you're spending more than 5-10 minutes in the toilet, then you need to watch it, because they are predisposing yourself to hemorrhoid. And of course, certain cancers of the abdomen and the pelvis can predispose a patient to hemorrhoid. And of course, people who don't eat a lot of dietary fiber, so if your food is lacking vegetables, lacking fruits and fruits, lacking some of the natural fibers that are present in our African diet, so that may also predispose you to developing some hemorrhoids.
When you're talking about those foods, so in terms of you wanting to get rid of hemorrhoids, if you now start eating those, if you were not eating them before, will that scale back the symptoms of it?
It does, because what the fruits and fibers do is, because the body does not digest some of these vegetables, we don't have enough the enzymes that will digest it in our tummy. It helps to make the stool to be bulky, and then when you drink a lot of water, it adds to the weight, so it just glides out and comes out naturally. You don't have to strain or force to push the stool out. So it's this straining and increase in the pressure that actually helps to pull the hemorrhoids down. So if your stool is soft, a little bit bulky, and has some water content, it can glide out without pushing the hemorrhoids out. And that comes to the classification. So more or less, you have 2 broad types. So you have the internal hemorrhoid and the external hemorrhoid. Internal hemorrhoid is in the rectum and comes out when it's there, and you can't see it, you can't feel it, but it causes some bleeding. We call that grade 1. So when it comes out through the anus but goes back after each bowel movement, that's called grade 2. When it comes out and you have to manually push it back, which at that point some people then tend to come to the hospital because it's causing some discomfort, you have to push it back manually, that becomes grade 3. Then when it comes out and you can't even push it back, that's grade 4. And at that moment in time, there is increased risk of infection, of rupture, of bleeding, and of other problems. So that's internal hemorrhoid. External hemorrhoids are found on the external skin of the anus, and they're usually quite painful when they become complicated.
Okay. So, I mean, we've already talked about what it looks like and all that, but what kind of foods triggers up or flares up hemorrhoids?
So this is one of the misconceptions that you see out there. So people tell you, oh, if you eat a lot of sugar, you have jedi as our local parlance. But so there is actually no particular food that we can say this causes hemorrhoid. What we advocate is you take a lot of dietary fiber. So avoid food that are too smooth or with refined sugar. So if you want to eat pasta, it's better you add some veggies or salads with it, rather than just eating plain pasta. So, but actually, there's no particular food, and I need to correct the impression: eating sugar does not cause hemorrhoid.
You see, and I think it's a lack of education in this area, and they say ignorance is not an excuse, but people need to know these things, and that's why you're here. So those who are thinking that, you're going to have too much sugar. Some people just say anything you eat that is sweet is sugar. It's like the classic, any condiment that you use for cooking is the one with the letter M. You know, so, but, I mean, as you're saying it now, people will now realize that it has nothing to do with sugar at all. There could be other causes, mainly. Okay, I mean,
what kind of foods could possibly trigger or cause flare-ups? Okay, before we get there, we can also ask, what are the things to look out for, symptoms?
Okay, thank you. So the commonest symptom for hemorrhoid, especially for the grade 1, is painless bleeding. And this bleeding usually comes after you have used the loo. So it's usually bright red, and in some instances, as you are trying to push some remnants to come out, you can just see a splash. So you describe it as a splash of blood on the pan. So you see the splash of red blood on the pan. The blood is usually not much for those who don't have who have mild hemorrhoids. Some people may also notice that when they wipe the butt after using the loo, they see blood on the tissue paper, or you see blood dropping into the toilet bowl. So for less commonly, you can have people that may have torrential bleeding. Some people have been known to pass out in the bathroom, or feel a bit dizzy or tired after using the restroom and passing out amounts of blood. But we must also know that there are some other conditions that can cause bleeding by rectum while you're using the loo. So it's very important that if you see blood in your stool, you should check your doctor out and have it evaluated. Other symptoms may include discomfort in the anus and a feeling of a fleshy mass coming out from the anus when it protrudes. And then some people lose you remember what I said, that it helps incontinence?
Yes.
So some people lose that control. So you want to release gas, all of a sudden you notice that there's something liquid coming out, and when you wipe, you see that you have some stool. So that's what we call seepage, or some mild incontinence can happen in some people that have those hemorrhoids. And of course, if the blood inside clots, they'll call it thrombosed hemorrhoids, can cause a lot of pain and infection and sepsis. And then,
okay, what are the effective options available for treating hemorrhoids?
So before a hemorrhoid is treated, it's best to always seek your doctor's advice. Although we know there are some home remedies you can be doing while you book for your appointment to see your doctor. So chief of that is to increase the fiber in your diet. So make sure that on the average you should have about 20 to 35 grams of fiber a day, and a handful of salad should be able to offer you that, and a 7 or 2 servings of fruits should be able to offer you that. So you should increase your fiber diet. Take a lot of water, and then you can use some stool softeners that are available everywhere in the pharmacies. So these stool softeners help your stool to become softer, or helps it to glide so that you don't have constipation. Then some home remedies will call sitz bath. So get a warm water in a large bowl, water that you can shower with. Maybe add a little bit of salt, a little bit of Savlon, or if you don't like that, you can just use warm water and sit down on it for about 15 to 30 minutes, 3 times every day, and every time you move the bowel, that can help. Then for those who their symptoms are not manageable by all this, you should come to the hospital where your doctor will evaluate you to exclude other causes of bleeding per rectum, and then offer the treatment that is available.
All right, we've got a question coming through via WhatsApp, and this says, is this different from pile?
So pile is a colloquial word. It's an old English word which generally refers to any protrusion from the rectum. The commonest protrusion from the rectum is hemorrhoid.
Right.
You can have a rectal prolapse, and somebody will also refer to us as pile. You can have a rectal cancer or anal cancer, and they all refer to it as pile. So I will say yes and no, but it's the doctor that will tell you whether what you're calling pile is hemorrhoid or is it something else. And it's important you have it checked up.
Wow. Okay. What happens if an individual lets a hemorrhoid go untreated? And when is it recommended to see a doctor?
So if you leave the hemorrhoid untreated, it can only get bigger, especially if you're not doing some of these home remedies or lifestyle modifications that we've mentioned. It could only get bigger. It could get more complicated. Maybe from grade 1, it can move to grade 2, it can move to grade 3, it can move to grade 4, and it can become thrombosed.
Grade 1 is the...
You won't see grade 1. You only notice that sometimes when you move the bowel, you see some blood in it. So grade 1, if not managed appropriately with some of these lifestyle modification or some of the treatment options that we're going to discuss later, can progress to grade 2 or to grade 3. People who also have prolonged hemorrhoid with this minimal bleeding over time may develop anemia because you've been bleeding consistently little amounts over time. And of course, with the progression of the disease, you have seepage, you can be soiling yourself, you can have infection, it can ulcerate, it can bleed, but however, it does not transform to cancer, if that's what people want to hear. But it's good to have it checked out because there may be something else in your abdomen that may be causing the hemorrhoid.
Hemorrhoids. Okay. A quick break, and we'll come back to you, doctor.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Hi Lagos, my name is Buchi Franklin and you're listening to The Smooth Drive.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned. This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Okay, welcome back, of course, to Smooth Health, brought to you by Evercare Hospital in Lekki. And we're talking about hemorrhoids and all that you need to know. And we have with us in the studio Dr. Arinzechukwu Mosanya. And we're going to take a couple of calls. We're going to take 3 callers who have questions. And the number to call, of course, is 014489 Call with your question. We need 3 of you to call us right now. So let's go to our first caller. Hello.
Hello, good evening.
Good evening. What's your name and where are you calling us from?
My name is Emmanuel. I'm calling from Lagos.
Emmanuel, what's your surname?
Akimbo.
Emmanuel Akimbo.
Yeah.
Okay, so shoot ahead with your question.
Yeah, I want to ask Doctor what he's saying. I think I have something similar to that because I used to have pain from my pelvic if I want to go to toilet at times. And at times if I want to fart, I don't know, maybe that's the cause.
So, Doctor, you heard what Mr. Akimbo has said. Well, what would you say to that?
Hi, Akimbo. So, basically, there are a couple of other problems that can cause pain when you want to fart or use the loo. Not necessarily a hemorrhoid. So, I think for the time being, you need to get to see a doctor who will examine your rare area and be able to distinguish whether you have a hemorrhoid or you have what we call a fissure. So, a fissure is a tear in the skin of your anus, and that's the commonest cause of pain while trying to fart or to use the restroom. So I think you should see a doctor, but in the time being, you could practice the sitz bath, like I said, use some stool softeners to make your stool softer while you book for your appointment to see your doctor.
Okay, so Emmanuel, you got that? Yeah. Okay, what you need to do at the end of the Smooth Health is to send us a message on our WhatsApp platform with your name as well, okay? Our WhatsApp platform is 0809 4440981. Thank you very much indeed, Emmanuel Akimbo. Okay, let's take another call. Number to call, of course, is 014489 If you've got a question for our doctor. Hello.
Hello.
Good evening. What's your name? Where are you calling us from?
My name is Paul. I'm calling from Mapapa.
Paul, what's your surname, Paul?
Ezejuo.
Pardon?
Ezejuo.
Ejiro.
Ezejuo.
Z-E-O.
Ezejuo.
E-Z-E-O.
U-O.
Oh, E-Z-U-O.
Exactly.
Okay.
Yeah, I think I have an issue like that. But for some time now, I've seen the bleeding. I don't know what is.
Sorry, can you repeat yourself? You said for some time now you've not been seeing the bleeding.
Hello, Miss. Yeah, Paul.
Exactly what you said. I have issues like that, but I noticed that for some time I will not be seeing the bleeding. At the time again, it will stop coming out again.
Okay, if I get you right, Paul, right?
Yes.
Yeah, you said sometimes you see the bleeding and sometimes you don't see the bleeding.
Yes.
So that's also typical of hemorrhoids, because when this bleeding comes, probably if you think back very well, your stool probably was hard.
Yes.
And you've not moved bowel for a while. So that hard stool as it's coming out can bruise the hemorrhoid and cause the bleeding.
Okay.
And then, of course, it will heal up by itself. Maybe your stool becomes softer again, and in between you won't see the bleeding. So it's not as if you'll be bleeding every time. But if you don't sort it out, yes, the bleeding may become more consistent,
more frequent.
Yeah.
Okay. Paul,
okay, thank you, sir.
Paul, what you need to do for me as well is to send me a message on our WhatsApp platform. That is 0809 4440981.
Okay, sir.
Thank you very much indeed, Paul.
Thank you.
All right then. Okay then, we got one more caller that we need to take on the show, and the number to call, of course, is 01448991. And our first 3 lucky winners stand a chance to win a 10,000 naira voucher courtesy of our sponsors, Evercare Hospital. If you have a question for Dr. Arinzechukwu here, please go ahead and do that. And our final and third caller, hello.
Hello, good evening.
Good evening. What's your name and where are you calling us from?
My name is Choma. I'm calling you from Bedleki.
Chioma, okay. Now, what's your question for doctor?
My question is, I had that issue of when I want to use the toilet, my penis is very stiff. But later I had this, when I forced myself, I noticed this blood stain, and I went to the chemist. I was given a capsule called amoxicillin. I should inject it. So when I injected this capsule, everything was now normal. I was not okay.
Okay, but you don't have that issue now.
I don't have it again.
Okay, thank you very much indeed, Chairman.
So I want to ask, so there's no need of seeing the doctor.
Okay, Chama, thank you for your information. If I get you right, did you insert this capsule in the anus?
Yeah.
Okay, great. So, Anusol is one of the remedies that you can use to treat hemorrhoid. However, it's limited depending on the grade of hemorrhoid. So, probably you had a grade 1 or 2, and using the Anusol may help, but it doesn't work for all hemorrhoids. So, I will also advise that you see your doctor to give you that clean bill of health. And of course, using Anusol alone shouldn't be the norm. You should also look at all these factors that can predispose to hemorrhoid and make sure that you correct them, like increasing your fiber and don't stay too long in the toilet, increasing water intake, and generally living a healthy lifestyle. So I'll still advise you see your doctor to give you that clean bill of health that you don't have a symptomatic hemorrhoid anymore.
Okay, thank you very much.
And Chairman, what you need to do, send me your details, your first name and surname on our WhatsApp platform 0809 4440981.
Sorry, I didn't get you.
Okay, telephone number to send your details to 0809 444 0981.
Okay, I'm sorry. Okay, I don't get my pen. 0801.
0809.
Okay.
444.
Okay.
0981.
Okay, thank you. Got it.
Thank you. All right, then, so that's it. Those are lucky callers, and Evercare will be in touch with whoever is the person that three lucky callers. So 3 of you get to win the 10,000 voucher courtesy of Evercare. Okay, I still got a couple of questions that I would like to ask, but you got one. I think you got number 8.
Yes. So how can a person prevent the development or the flaring of these hemorrhoids?
So the first thing I will want to say is we need to increase the fiber in our diet. We need to eat healthy food. I know that may be difficult in a place like Lagos where everybody's busy and maybe fresh leafy vegetables and fruits may not be commonly available. But if we make efforts to be able to get that, there are also commercially available natural fibers that come in grains and bran and that we can make as a cereal and take, and this can increase our fiber intake. Secondly is to reduce the length of time we spend using the toilet, and then change some of our lifestyle habits. I mean, the time to use the toilet is not the time to reply mails, reply chats, or browse the internet. Time flies, and you realize that you spend 30 minutes, 1 hour. That puts a lot of pressure on the rectum and predisposes you to moving. So once you've done the do, it's time to leave the loo, as we get to say. Then, of course, take a lot of water, exercise, and live a healthy lifestyle. But then there are, like I said, there are some non-modifiable factors. I mean, the older you get, or if you are pregnant, you may be predisposed to hemorrhoid. But it's time to, at that time, you need to see your doctor, who will advise you on other things to do. And there are some office remedies and office procedures that can be performed if your hemorrhoid becomes symptomatic. Yep.
Okay. Someone just sent a question. How can it be managed in children? Do children have hemorrhoids?
So hemorrhoids are actually not very common in children. But then again, if a child has a protrusion in the anus, we need to be very sure that is not another type of protrusion that we also commonly refer to as piles, which is rectal prolapse, or some other polyps in the rectum coming out. So it's best if a child has such thing, let him see a pediatrician or a pediatric surgeon who will review and reassure you that it's not a prolapse. Or if a child develops hemorrhoid, then we need to look at the diet of this child. Is it good? Is it high in fiber? Is the child taking a lot of water? Are there some anatomical problems with the child's backside that may be predisposing this child to having? But generally, hemorrhoids are quite uncommon in children. So I'll still advise that person to seek out a doctor and have it checked out.
Okay. And finally, doctor, please tell us how can individuals listening to the show right now contact you at Evercare Hospital?
So if you have any hemorrhoidal tissue or you need to see us at Evercare, we are located at number 1 Admiralty Way, Bisola Durosimi 80 Drive, Lekki Peninsula Scheme 1, Lekki, Lagos. Our website is www.evercare.ng, and you can reach our customer care services and patient care experience on 081 3985 0710. I'll take that again, 081 3985 0710 to book an appointment. And if you have any further questions or inquiries, you can send us an email on info@evercare.ng. That's info@evercare.ng. I'll be glad to attend to you.
I'd like to say thank you very much indeed, Dr. Arinzechukwu Mosanya, for coming on and giving people the heads up, all they need to know with the gut hemorrhoids. We've got people who have made phone calls as well and asked questions. So I think it's an enlightening thing for people who do not know about it, and then they confuse it with something else, and with the general notion that it's caused by nothing more than sugar, which is not actually the case. But it's good that you're here to educate the listeners that it has nothing to do with sugar. It has to do with other causes, lifestyle, and what and other things that we do that could be a cause. So if any one of you has any issues with it, don't hesitate to contact Dr. Arinzechukwu Mosanya at Evercare Hospital. He's given you all the details, and I'll reiterate that again. Location, of course, of the hospital is at number 1 Admiralty Way, Bisola Durosimi 80 Drive, Lekki Peninsula Scheme 1. Website, of course, to contact them is www.evercare.ng. Telephone is 0813 985 0710, and you can send them an email as well at info@evercare.ng. Once again, Dr. Mosanya, thank you for coming on the show.
Thanks for having me.
Okay.
Thank you, doctor.
And then, of course, that's the end of our show for today. And talking about smooth health, the smooth drive continues with Zibi and Jeannie.